So welcome to the League of Women Voters conversation, and we're having a conversation with Julie Pryde, who is, of course, the Chief Executive Director of the Champaign-Urbana Public Health District. And I know we are all very, very grateful for Julie's incredible leadership through this whole pandemic process. And we know that our community has handled this so much better than many, many communities. And a large part of this is due to Julie and her staff. And I know her staff also works very, very hard. So as we have seen through this pandemic, things keep changing. And as the holidays are coming up and as the children's vaccine rolls out, I'm sure people have a lot of questions. And so we wanted just to provide you this opportunity to get answers from a very trusted and reliable source. And so this is what the format will be. I think Julie will have a few words to say to begin with, but then we want to give you a chance to ask your own questions. And what I'd like you to do is put your name in the chat, just your name, not your question. And then we will call on you in order, and then you can ask your question yourself. So if you're muted when you're called on, you'll have to unmute, but that way we don't have to interpret your question and you can get a full and real answer. So we're going to start now. So Julie.
Okay. Well, the biggest thing that just happened is just about 5 minutes ago. Well, not five, about 5 minutes ago, I hit send on the press release for the children's booster or the children's clinics for ages 5 to 11. So that has been much anticipated by a lot of people in our community. So we will start those Friday evening and Saturday morning, and then we'll just continue doing them. Walgreens, Carl, other places are going to be doing them as well. So that's the big thing, because all of us know that kids are little vectors for bringing in viruses, especially to homes and gatherings and things, even sometimes if they're not that sick. So it's good to be able to finally do that. Where we are right now, let me look at my little board over here. Our community is really highly vaccinated. Let me pull up my one thing. I just knocked it off. There it goes. So we have a very highly vaccinated community, more so than is actually reflected in the statistics, and that is because, again, of the student population. Students at U of I they just often use their parents' addresses for things. That's sometimes because they give their ID, or sometimes because they give an insurance card or whatever, but they are often counted in they're counted in our denominator, but they're not counted in the vaccines if they did not give that address. It doesn't matter if we gave the vaccine or not. So if you look at our county, you'll see, we're very highly vaccinated, which is great, but that's certainly not everyone. We're right now up to 351 active cases, 13 hospitalized, and 207 deaths. Vaccination rate right now shows that we are, again, U of I, I just have to clarify, they are now up to around 95% of all undergraduate and graduate students vaccinated, which is amazing. I believe it's one of the highest in the entire country. But our county right now shows that of those eligible, we're about 63.92% fully vaccinated, 72.82% with first doses. The good thing about that is that's a lagging thing, because it takes, either 2 or 3 weeks or 4 weeks to be able to get the second dose. And the numbers almost always catch right up. So that tells me that we're well on track to being, I'm guessing we're around 80% at least vaccinated in this county of those eligible. And now with the kids, right now we're around 65% of eligible kids, 12 to 17 vaccinated. So we anticipate the same with the younger children as well. So that we're pretty happy about. you know, the hospitalizations and the deaths, we are still seeing those in unvaccinated people. It can get really serious really fast. So that, excuse me, I've been asking everyone all morning long, Moderna, are you here for your Moderna booster? About 50,000 times. So my throat is a little weird. So I wanted to give you kind of a little bit of a rundown too, because I know this group is interested as we move into the holidays, how you can do things, you know, safer. And you absolutely can do things safer. Number one would be, these are our recommendations of public health for safer gatherings in general. We give this out to all agencies and different places that ask us when they're planning something. So number one, if you can make it a vaccinated only event, do that. That's obviously safer. And you can consider, you know, having cards checked if you want, depending on, obviously, if it's your family, hopefully you're going to know who's vaccinated and who's not. Masks are optional in that type of group, unless you have someone who is very much at risk, then you might want to consider it. Same thing with people with severe immune compromised situations. But, you know, we're saying events are going on. I mean, they're going on all over our community, and they seem to be doing quite well. Most of the outbreaks that we are seeing are in groups that are unvaccinated. Lots of infections right now in schools and daycares, you know, kids' ages. So hopefully the vaccines will help with that. So the other thing that you can do, let's say, let me just give a kind of let's just use Thanksgiving. So you're going to have a Thanksgiving dinner, and let's say you want to have 10 family members there. The safest way to do that would be to make sure everybody's vaccinated, but then test prior to. We have ample free testing in this community, and we also now have access to rapid tests that you can pick up at you know, Walgreens or Walmart or anywhere. And I think they run around $10 a piece. There's usually 2 in a box for $20. And if you can't get, or somebody can't get to the testing prior to the event, then you can do that. I use my daughter's wedding reception as an example of how you can do something safely. We did the same thing. It was a vaccinated only event. It went down. It was originally scheduled for 250 people. It shrunk down to around 80 people. So we would have more space in the venue. And then with the pre-event testing, that knocked out 6 people who then were not in there. So, you know, we were able to, knock wood, have that and not have any problems at all. So there definitely are ways to do it. It's a little more time consuming than, you know, just inviting people over, but it's also safe. So.
Well, thanks, Julie.
Mm-hmm.
I think I want to remind people the way we're handling this is, if you have a question, to put your name in the chat, and then we will call on you and you can ask your own question. I'd like to start with a question, unless you have some more things, important things you want to tell us.
Anytime you want to go. I just will say that the boosters are available basically. You know, we're just saying 18 and up, and it's been at least 6 months since your last booster, 2 since your Johnson & Johnson vaccine. And the reason why is that around 89% of people are eligible for that, given the parameters that the CDC has put out. We do not have time to check all that, nor does anyone. So people attest to their eligibility for it and going in. Everyone 65 and older is eligible automatically. And then anyone in that category, 18 to 64, with any of the, you know, 89% of our population has some type of underlying health condition that fits in there, and also a job that puts you in contact with the public. So it's really a huge swath of the public that's eligible.
So my first question is about booster shots, and is whether there's an advantage to mixing and matching, or whether there's something, a strong disadvantage to that. So say you have Pfizer and you get a Moderna booster, or vice versa.
Really, the only significant difference is shown if you've had the Johnson & Johnson first dose And then when you go to get your second dose, or when you go to get a booster dose, get one of the mRNA that's really shown a difference. So if you had Johnson & Johnson and you get Moderna or you get Pfizer, that's really where the most has been shown. Other than that, we've seen very little mixing, although it's perfectly fine if people choose to do that. We haven't seen or haven't heard of any negative effects one way or the other. Certainly that was all approved through the CDC. So that means the studies back up that it's, safe and effective either way. But I was Moderna and I ended up getting the Moderna booster, and I had pretty much of a knocked on my rump after dose number 2. I had a good 18 to 24 hours where I was just really like flu-like and just miserable. And with the booster dose, I really didn't have that. I had maybe I was a little tired, but nothing that made me stop working or anything like that.
Hey, Sarah, maybe you could go out and then come back in because you're flashing up on the screen even when you're muted. So I'm not sure what the problem is. So the other question I had has to do with vaccine for kids, and even parents who are who have readily taken the vaccine might have a few misgivings with vaccinating their children because they've heard about side effects. So can you talk about that?
Well, I think that anyone who has any hesitancy or concerns, probably the best person to talk to about that would be the child's pediatrician or your family practice provider, because they're going to be able to answer your specific concerns the best. They know your child, they know your child's health, etc. But in general, I can say any side effects are far less significant than the potential of side effects from getting COVID. There are the multi-system inflammatory disorder that kids can get with this, and if they get mild myocarditis, it is typically mild with the vaccine as opposed to severe with the illness. So those are kind of the general things, but often parents will have a specific concern, and the best person really to address that would be their child's healthcare provider. So that's what we encourage.
Initially, when the cases first starting in, there was a real concentration on older people, and it seemed like young people very rarely got the virus. And has that just changed over time?
Absolutely. I mean, there were a lot of cases in younger people. There just weren't as many hospitalizations and deaths in younger people, although they have occurred throughout the entire pandemic. Okay.
So I think we'll start asking some other questions. So Bridget Melton, you want to unmute yourself and ask your question yourself?
Sure, thank you. My question was just about pregnant women, and if they have a normal, healthy pregnancy, when are you recommending that they receive the booster?
Well, they are absolutely encouraged to get the booster, but I would leave timing up to, talking to their own healthcare provider for that.
Okay, thank you.
Yeah, but they are recommended to get the booster.
Okay. Many of us, as the summer started and things seemed to let up, but gotten back to eating out in restaurants. And so what would you say is your current recommendation for restaurants, whether inside or outside?
So I've eaten out inside and outside pretty much since summer as well. That's really about the first time I started as well. Again, if you're vaccinated, and it's going to, the thing with restaurants is how well are they doing? And around our community, they're doing great for the most part. So, they have more space in there. So the bigger the restaurant space wise, so if the tables are all crammed together, that's going to be a little a little more risky, but if, you know, most of the places that I have been, the restaurants are doing a great job. They're moving the tables around. They've got their staff in masks. They have people wear the mask when they go in there. I will say that some of the chain restaurants, any place that is attracting a lot of people from outside of, you know, Champaign, Urbana, those sometimes are not as, they just aren't following the guidance as well. So it's kind of an individual risk analysis that you have to do for yourself. How much risk are you, you know, willing to take? But a lot of them, like I said, I've been comfortable going and eating out in restaurants after I've been vaccinated, so doubly vaccinated. But again, I started about summer, and the more vaccinated our community is, the safer these things are going to be, because the less likely you are to encounter anyone that has it. And even if you are, so if you're vaccinated, you're less likely to catch it, obviously, but you're also less likely to spread it. So, you know,
Hey, Carol, do you want to take over monitoring the chat list?
Sure. Yeah. Well, I actually have a question. Can I ask mine?
Sure.
Sure. My question is, especially with children, do you see a problem, or is this like something you should always talk to the doctor about, with having the flu shot and the booster at the same time?
well, I don't think you'll probably be able to get that anywhere right now, unless it would be in a doctor's office, just because we're just focusing on our mass clinics are focusing just on the one or the other. And right now we're focusing on COVID, but it is supposed to not be an issue at all. So if you have a specific, you know, issue or a specific question about your child for whatever reason, you can ask a healthcare provider, but the recommendations are there is no need to wait between vaccinations.
Okay. Teresa Michelson?
Yeah, Julie, would you talk again about the self-testing things one can do? Because, you know, I know if you go like to Canada, there's only one kind of test you can use to get in. But then I've heard these stories about someone maybe, and they test positive with one of these less reliable tests, and then they get the real test and they don't have it.
Yeah.
But anyway.
So the rapid test, the 15-minute test, the ones that you can buy or that some schools are doing, they do have a little bit higher false positive rate. So because they're more of a screening test. So if you were to use that, so in our community, again, if you're going to have a Thanksgiving gathering or some type of gathering and you want everybody to test, they can easily go and get it here in town at, you know, for free. So the mall takes a little longer, but it's usually back within the required time. But both Parkland and U of I sites and their community sites for everyone, they're the saliva-based testing. They get the results back in usually less than 24 hours. But if you want to use the antigen test, they are still a great, you know, tool to use. And those are the ones that you buy at the store, and they're 15 minutes or so, and they're very easy to do. I can tell you, I've actually done them. When I was sick with that hideous cold that was going around, that RSV cold, I did it just to make sure I didn't have COVID. And, you know, you just swab your nostril, both sides, and then you stick it down in the little tube, break it off. And then that basically little juice that's in there, you drip that into it looks like a pregnancy test type of thing. And then it wicks up, and it'll show you if you have, you know, there'll be the test line, meaning that the test is valid. So if it wicks up past that, that means the test is valid. If you see that line, and then if it wicks up and you see another line, then you are positive. Otherwise, you're not. So it is a good tool to use. Now, if you were to use that, then we would still, before it was counted as an actual positive, we would still have it verified. So.
I see we have a question from Judy Iverson. Judy?
Yes, Julie. My question has to do more with logistics, with the thousands and thousands of people that are being tested for COVID, or the thousands of people that are getting COVID shots. How do our medical providers get the information that we have had the shots or the booster? I mean, just the sheer numbers of people, how do they know? Or is it our responsibility to tell them or show them our COVID shots, or just how does this work?
Okay, that is a really good question. And it's one I don't think to answer because it's just part of our lives here at Public Health. So I don't think to answer it, but it's a really, really good question. So no matter, okay, let's start with tests. There are all these reportable test diseases out there. We deal with them every day. So salmonella, various STDs, measles, mumps, rubella, any of the vaccine reportable diseases, all of these are reportable. That means that the laboratories where the tests are run or the physician's office they're mandated to report those into Public Health. They're super good at it around our county. I mean, they get them in. And if it doesn't matter if you test in, Texas for something, we're going to get that information like immediately. So, and each one has its own reporting thing. So with COVID, all of those test results come to us officially. Now, you may find out about it first because the app may contact you first if you're doing it around here, because it's a super efficient system, but we're going to get it within the required hours that it has to be reported. And then we follow up on it. Every communicable disease that we deal with, every reportable disease has its own algorithm that we have to then do a case investigation and follow up. And that, again, that's for all of these illnesses, not just COVID. COVID is just the one that people hear about, but we do contact tracing, every single day. So these are mandated to be reported to the local health department. And if somebody tests positive here and they live somewhere else, it goes in through the system, the state system, and they will get it to the correct health department, wherever that is anywhere. So as far as the vaccinations go and the boosters, the little cards are really not that, those are for you to use, or whatever. It's not really an official record, although some places are allowing them to be, but all of those are entered no matter who. All right, let me start this way because COVID is a little bit different. So all of the COVID vaccine in the United States comes through the CDC, right? So in order for us to get it from the state or from the CDC, you have to sign all these agreements to do what is required with it. So when we get those doses, there is a lot of stuff that has to be done on the back end, inventory and all of that. And thank God I have staff that does amazing jobs with that. And then when we give them out, let's say a school is going to do a clinic and we give them that, everything, each dose has to be matched back, with the paperwork or a wasted dose. So all of that information comes back to Public Health and for the ones that we operate, and then those are reported into a system called iCare, which is the state's immunization database program. You can go into iCare, anyone, and register in there and pull up all your vaccination records. Carl reports into that, OSF, everybody that has any access to this vaccine has to do that. So that's how they get in there. And we have a whole teams working to get this data. When you fill out that blue sheet when you get your shot, that's the information that goes in there. And then that goes into the iCare system. Along with, so it goes in there and it'll have your name, your demographic information, address, everything. And then it'll have the vaccine you got and the lot number. So should at some point there be some kind of a recall, let's say, where they say we found out this lot didn't work, then we would be able to then reach out and contact everybody that had that and be able to redo it. We do not anticipate that happening, but that's why, all that information is in there. And iCare system can be accessed by you as individuals for your vaccine records. You have to go on the Illinois Department of Public Health website and type in capital I, I care, and then it'll tell you how to do that. I am not going to lie, I have not done that yet because I have been too busy, and I will probably require one of my kids to do that for me. But it will pull your record up, and then you can also go in if you have MyCarl or Epic or not Epic, but whatever the patient portal is that Christy uses, maybe the same thing, I'm not sure, but you can upload it into there as well. Also, your healthcare provider can look it up in there. Now,
So there's no way that the public health is contacting the medical facilities to give that information to the Carl or OSF or Christie?
no, they're all put in the database. Carl and Christy will put in all their stuff that they do into their, into iCare. And then I don't know, they probably have it in the patient record too. I honestly don't know that for sure. But all the ones we're doing, or the people we're working with doing, those are in iCare, and then you can either print it out or you can upload it into your MyCarl if you have Carl, or and then your healthcare provider can go in there and look. Yeah, but what they're not doing right now is automatically. There's no way that they're automatically uploading them. At some point, that's going to be a thing, but it isn't right now. So if you lose your card, do not freak out. It's not a big deal. And you can have an electronic passport. There's a lot of different things you can do. Really, the most issue has to do with international travel. If you're going to do any international travel, just find out what are their requirements of the airline you're going on and of the country you're going to. And then, you have plenty of time to do that. It's usually a test is what they require. So, and some do require vaccination records, and some require them electronically, and some require them other ways. Some countries want them to be signed off on and by the healthcare provider. Some want them to be signed off by a health department. It just, every country kind of has their own rules, and sometimes those change. So it's a good idea if you're going to travel internationally, check with that.
Okay, we do have more questions. Judy, that was a really good question. And Julie, I enjoyed I learned so much in your answer. That was really interesting. We have a question from Kathy Bowersock. If you can unmute yourself, Kathy.
Oh, hi, Julie.
Hi.
So we have been very cautious at our church. We are doing in-person worship where we're spaced out and everybody is masked. And we have not resumed coffee fellowship because, of course, that's people gathering and consuming food. So we should keep not gathering, I guess.
Well, that is the same type of situation as, a restaurant, essentially. And I am very familiar with your coffee chat area, and it's a large space. So, that's again going to be up to you and the individuals involved in that. But you could do that. Again, it's not going to be safe for people who are unvaccinated, but it will be for those who are pretty much. And just, you would just try to keep people either at the tables where it's a family group, or just stand farther apart and mill about with your coffee, and keep your masks on when you're not, because as I recall, those are more chatting than chomping anyway. So, get your coffee and then keep your masks on while you're talking.
Thanks very much.
Yeah, but you can do it. There's a lot of safe ways to do things. And I can, send you this if you would like, this list of how to do the activity safely. And again, our numbers are going down in our community, and you can always look at the zip codes to see, where we're having kind of more little outbreaks. But what's going to happen with this? The pandemic is going to become endemic at some point here. And what that means is that it will be more like a flu, and it will probably be, although I can't say for sure, but it'll probably be like a seasonal endemic disease where you have, it's always out there somewhere and anybody could get it at any point, like flu, because if flu's out there, somebody can get that. But it tends to be more of have seasonal outbreaks. So just like flu and norovirus and the different things tend to be in winter, this will probably be in winter as well. But it will be the same kind of thing. I don't know if we will have flu shots for this always, or like a flu shot, if we'll have to have one every year. I don't know for sure. I don't know if will combine the different winter viruses into one type of shot. I don't know. There's a lot of possibilities, but when it becomes endemic, which it's becoming, it's going to be, well, let's just say this could have become endemic through mass vaccination, people taking, we would have had far fewer deaths, but that's where we are. And the deaths are going to continue happening as long as people just refuse to get vaccinated, because they are going to continue to be vulnerable. And right now it looks like, the virus isn't, we don't have some variant that's hovering, scaring us right now, but it could happen. And so if it continues like it's going, it will become, like I said, endemic, and then there will be various levels of people in places that are more at risk. If you're in a highly vaccinated community or where you have a high level of immunity, you will have less there. Will there be pop-up cases? Yes. Will there be little outbreaks like we get every year with norovirus or flu in nursing homes or things like that? Yes. So, vaccination is, especially in those areas, are very critical.
Okay, we have some more questions, Julie. Joanne, Vision, if you want to unmute yourself and ask your question.
Yeah, I had a question. I recently about performance venues. I just recently bought some tickets on the Virginia site, and I just did it online, and it shows you what's available, what isn't.
Mhm.
And it did not appear they were doing any kind of like blocking out seats between. I can see how difficult that would be. People are buying 1 or 5 or 4 or whatever.
Mhm.
And I didn't know if there was any general guidelines that businesses, Cranert or community theater,
It's this, we have the same, and it's on our guidance list here too. Again, the ideal thing is that they make events vaccinated only or testing only events, so that you could make sure that you don't have, an outbreak in there going in. But it's in a place like the theaters and the performance spaces, they're pretty large. They have lots of, ventilation and they're high ceilings and things like that. And typically people are, while they're sitting next to each other, they're mostly, facing forward, and they do require masking in them. So you've got all those things, going for you, but it certainly makes it a lot safer. But yeah, I think that the trying to do seats, spacing between the seats is extremely difficult. I've been to many movies throughout this. I think I started that in the summer. I've been to quite a few movies, and it's easy to do it there because there's hardly anyone in there.
right.
So, I mean, there's literally, although I do notice they all tend to get in the handicap accessible seats, which is frustrating because my son needs that. So, that's irritating, but there are lots of seats. So going to a movie has been super comfortable for me anyway. And I'm not one that tends to sit there and eat a lot during a movie, but I do sporting events, but not so much movies. So
Okay.
I feel very comfortable.
Thank you.
Judy Iverson, you have a question?
One more question and then I'm done. I recently went to one of the basketball games, and in spite of the fact that they were putting up an announcement and script that everybody was to wear masks and only not wear masks if they were eating, there were a significant number of people around us who made no attempt whatsoever to wear masks, even coming in or going out. Is there any movement towards requiring that you provide your vaccination status to get into some of these events. I also understand that it's extremely difficult, and I would not even attempt to do it, to speak to somebody who is obviously not wearing a mask, because you don't want to get into that kind of a
Right.
altercation.
Mhm.
But, you know, and I understand where the people at the State Farm Center don't necessarily want to be policemen and do this, but it became increasingly uncomfortable as the game progressed to see more and more and more and more people not wearing masks.
Yeah, and that's, you know, very disappointing. And it really is the people who are unvaccinated that are putting themselves at risk. If they're going to things like that and they're unvaccinated, they are really putting themselves at risk. But yes, I do find that very frustrating, because we know we have high vaccination rates in this county, certainly not everyone, but we also know that people come from all over for those events. So, you know, that is something that I think was going to be difficult to, it's going to be one of those situations going to be difficult to address. And I know that U of I has rules up, but it's like anything else. We have rules up, but not everyone follows them. So, you know, and we are in communication with the U of I all the time. So we will certainly bring that up, that if, you know, the game I was at, there weren't that many people there, so it was less concerned because they were it was one of the kind of pre-games, they were all spread out, but it's going to be very packed, and I know that some have sold out as well.
Teresa Michelson.
This is going to be a little garbled question, but I know you can maybe help me figure this out. So I'm interested in the endemic nature of the COVID going forward, because the seasonal flu, we get these shots. Supposedly there may be effective, the shot for, I don't know, 4 months, 5 months, which is why they tell you to take it later. Do we know the effectiveness of the COVID shot? And from what I heard, you know, the rate at which people get the seasonal flu shot isn't super high, I don't believe. So what would be the expectation that, you know, people are going to continue not to get the shot, but the COVID, which just seems a much more serious flu, is floating around out there?
Yeah,
You know,
well,
what will it look like?
Well, it will look, you know, it's going to look kind of like flu. I think for a while it will be more like a severe season of flu, you know, like we're seeing now. We're seeing a lot more cases of COVID, but as everyone gets some immunity, either through vaccination or through infection or through death, because, you know, certainly we're getting close to, in this country, 1/4 or 3/4 of a million people dead from COVID. Many after the vaccines were widely available. So, you know, we're still going to be seeing pockets of that in the places that aren't vaccinated or aren't immune due to either infection or that. They're still going to be able to get it. Now, infection is kind of like getting a vaccine, only one where you risk, you know, death instead of just getting the vaccine. But that's what, you know, endemic means, that it's just out there. It's just going to be out there like one of our other vaccine preventable diseases that we have out there. And if people stay vigilant with it, you know, they'll remain protected from it. But those who don't are not going to be protected. And I can tell you what concerns me even more than that is the fact that we have now seen in this country, we have now started to see this bizarre anti-science mentality out there, and places almost trying to, well, in my opinion, out-stupid each other to see what they can do to be more outrageous. And I believe it was Florida that was looking at doing away with all vaccine preventable disease mandates for the schools. Now, if that happens, I can tell you exactly what we will see. we will see kids and adults getting measles, mumps, rubella, polio, diphtheria, tetanus, things that, you don't see. And I guarantee you, if people see a few cases of diphtheria or tetanus, that should be quite the wake-up call. And it's so insane to me, but what will happen is exactly that. They will come back. These diseases are endemic in our country. They're still here, where they can be imported in easily through travel, and they often are. We have multiple times where people will go on a vacation to another country where measles, for example, are more prevalent. And if they are unvaccinated, they are going to get it. And then they bring it back here, and sometimes it spreads, usually it spreads within a family is where the outbreak is, because most everyone is vaccinated against that because of school mandates. So to see something like that go away is just, I really can't even wrap my brain around something so crazy as that. So let's hope that that does not happen.
I just got a text from someone who cannot attend, and she had a question about if you have any sense of when, is there any benchmark as far as the mask mandate going away?
Well, the governor just addressed that yesterday, so that's a state mandate. Everybody thinks that's a Champaign County mandate. It really isn't. It's just that our county does a really good job of doing it. People in our community wear the masks. The mandate is what's holding back the getting rid of the mandate for masks is the hospitalization rates, and they're still up there. They're still pretty high. They're still causing strains on hospitals. We've got to make sure that we don't overwhelm our healthcare systems, and we're getting ready to go into, fall. And while our community is doing pretty well, that's not the case all over the state. And even with us, let me look real quick. So, we have different, we have a large catchment area for our hospitals. So, well, right now there's 53 people in the hospital. At the one Carl in Urbana, there are 42 hospitalized and 14 in ICU. So that's, that's specifically with COVID. That's not including everything else. So, you've got to protect the healthcare systems. And so that's really what he said yesterday is kind of the holdup. What the benchmark is, I don't know. I would say probably getting hospitals back to more of a normal baseline than all these COVID cases. Because the COVID cases, especially in ICU that involve the ECMO or the ventilators and things, those require a significant amount of staffing for those and care.
That's all the questions in the chat room.
Okay.
I have a question. What is the plan for rolling out the vaccine for the 11 to 5-year-olds? Is there, the school is going to be involved in this?
Well, so far, the only school that has, it's now been 45 minutes since we released the thing. So I'll get on here afterwards, but I'll bet you it's at least halfway full already. So, and we also release those out to our community partners so that if they need help getting people signed up, they can help them do that. And but so far, the only school that is doing the kid vaccines at this time is Urbana. And as of, let me think, as of, I think last night, they had well over 500 already signed up. So, but we have it out there. Walgreens will be doing it. Kids can get it through their pediatrician's offices. It's going to be the same thing as with the rest of the vaccine. We will have a lot of different ways for kids to get it. And like I said, our first vaccine clinic is going to be Friday night. We're already scheduled through tomorrow for the booster doses, and that takes up all the bandwidth we have of nursing staff and with our community partners. So we will be going Friday night and then Saturday morning to get those initial ones that sign up out of there and get them vaccinated. And then Walgreens and all the other places will have those as well. So I keep saying Walgreens. I do want to remind people to always look at the different pharmacies out there, because people don't think about Costco and Walmart and Meijer and Sam's and Schnucks and Target and any place with a store that has a pharmacy in it. Those, they have them as well. So they usually have them as well. So, you know, you just have to check with them to see if they do.
So there'll be more community vaccine clinics for kids
Oh, yes.
going.
We just keep doing things until the demand goes away, basically. So that's kind of how we started out, and then we just keep adding and adding until the demand goes away. And then the ones without a lot of demand, then we'll have another way for them to get in.
So are you seeing a good rate of vaccination for kids?
Well, we only know right now from 12 to 17, and we're up to around 65, 66% right now of those eligible have gotten them already. So we anticipate it could be about the same for the 5 to 11-year-olds. We just start doing them, and then always at the beginning, there's a huge demand, but there is no supply issue. That's the important thing for people to know. At the very beginning, when we were doing these in January, you know, the supply was really tight. We just got a little bit at a time each time. And so that's why there was so much problem there. That should not be the case this time.
Do you have any information about when the vaccine might be available for 2 to 5-year-olds? I have a 2-year-old grandson.
I do. It's actually, I think what they're doing next is going to be, I have to look at this. I think it's like 6 months and up to 4. And then, so the last I heard is that is supposed to be ready around, you know, January. Let's hope that is the case, because once we get to the place where everyone in the country who wants a vaccination can have a vaccination, we can't make them take it, but if they want it, it's available to them. And that means everybody has an opportunity to be protected. Then that's when we're going to be moving into the kind of the different stage where you'll start seeing it's going to, you know, we'll just have to worry about potential spikes that come that could threaten the healthcare systems in places. Again, I don't look for that to be an issue around here because we have a ton of immunity. So but there will be places, I mean, there are entire counties and places that just have horrible vaccination rates, horrible. Even our lowest vaccinated zip code in Champaign County, which is like Penfield, it is still higher than, you know, many of the counties in Illinois. So,
do you see a time when the COVID vaccine would be a school mandate for school entry?
You know, I don't know. It's probably going to be more like flu, which is not a mandate for school. If I ran the world, every vaccine preventable disease that's out there would be mandated, especially for people who work with vulnerable populations. So anyone who works with kids, anyone who works with seniors, anyone who works with people that have illnesses, you know, hospitals or whatever, those would be mandated because, you know, you can have a long-term care facility that's 100% vaccinated clients, but if you don't mandate it for the staff and the visitors and everybody else, it's still going to get dragged in there. And we, unfortunately, every single year we see deaths from flu for that. And we've certainly seen plenty of COVID deaths because of that. And it's just, to me, it's just, that is such a simple thing. Such a simple thing.
I'm sorry, I forgot my question.
That's fine. I probably forgot the answer. So just take your time and when you think of it.
I guess since the it seems to me that one of the very minor benefits of all of this has been a reduction in other kinds of communicable diseases, just because people are not out and about. And I assume that that's a real effect, and that at least in general, people might be a little bit healthier.
Yeah, certainly last year that was the case. I mean, we saw almost no flu. That is not going to happen this year. We've already seen some flu. So that is unlikely to happen this year. So get those flu shots if you haven't already. But even if somebody has had flu, we want them to go ahead and get it, because the vaccine, the flu vaccine, typically protects against 3 or 4 different strains. And you can certainly get an A strain and then get a B, later on in the year, which is super unpleasant, but it happens. So
does masking protect against the spread of the flu too? Yeah,
well, so what the masks are doing are keeping your breath closer to yourself, right? So if the next time it's cold, so tomorrow morning, when you can see your breath, go outside and take your mask off and just talk, stand in front of your car window and talk, and you'll see your breath. And that's every time you talk, that's what your breath is. And then if you cough or something, it obviously goes farther. And then put your mask on and do it. And it's not keeping it all, in there. And if somebody breathed right in your face, it would still go through. But what it's doing is keeping everybody's breath much closer to themselves, so that it's just not out all over. And that's what it does. And so in that sense, it helps. So if you have something that you don't know about and you're wearing a mask, you're not as likely to be spreading that out there to everyone. So yes, in that sense, it does help. But this year, people are going to be out and about a lot more, and there are going to be a lot less masks out, and people are going to be meeting a lot more. So, don't expect to be free from all the winter colds and things like we were in the past. Now, if we keep the masking on or staying farther apart from people, that's absolutely going to help. And always keep the hand washing up, because nobody wants that norovirus in the winter either. So
it seems
but last year was the first year in my entire adult life, I did not have a sinus infection. And it was because of the masking and not getting my usual, hard winter cold of some sort that then turns into everything turns into a sinus infection for me, it seems like. So that was kind of nice. And I think that from now on, probably the rest of my life, when I fly, I'll probably wear a mask, because I have gotten some kind of nasty colds on planes in the past.
That was my next question. On the U of I campus, that you used to see masks by Asian students even before the pandemic, because I gather it's much more common there. So it seems like if there are health benefits, it might be just to become a more common practice of wearing it.
I think it will be. I think for a lot of people, it will be that they just, especially if they're out in public around people, they don't know, that they probably will do that. I don't think it's going to be mandated in any way, nor is it mandated in a lot of the Asian countries, but it shows to be effective. So, when something works, some are going to stick with it.
We do have a question in the chat room. Kathy, you want to unmute?
Hi again, I'm sorry, I have another sort of question. So I have a brother, Julie, who is an anti-vaxxer and who became very ill late August and early September. He lives out of state, and now he's in Florida for the winter. I think he thinks he doesn't need to worry at all about getting the vaccine. What?
No, he does. He does need to worry about getting the vaccine, because he is not going to want another assault on his system if he gets it again. But he absolutely can get it again, just like people can have breakthrough infections after they've been vaccinated, although they're often less. And I don't know what type of damage or anything he could have had from his case of it. So that's something he needs. He really does need to get the flu vaccine and the COVID vaccine again. People who have had the COVID vaccine or who have been sick with COVID and then get the vaccine have a really good immune response to it. And then they're a lot more protected. but he definitely needs to get the flu vaccine as well. You don't want to just keep having, assaults on your respiratory system, really, if you can
Thanks.
prevent those.
Thanks for your insight.
And then I think one final question, do we have any information about how long the vaccines are going to be effective?
We don't, because, now we're to the booster stage and they just have to kind of see, there are always the group out front that have been tested on, and they keep following them and seeing, how long that they're going to last, but we don't really know. It could be that, the reason why let me just tell you, the reason why we get flu vaccines every year is because it's not because the vaccine, quits working, if you will. It's because the influenza vaccines mutate a lot, for one thing, but also we get different combinations throughout the year. So each time you get a flu shot, there's, like I said, usually 3 or 4 strains in there, depending on which kind you get. What they do is they look at the Southern Hemisphere and see what was most prevalent during that season, and then that's what goes into our flu shots for the next year. For example, H1N1 is now in there almost every year because it's still circulating. So even though we're not seeing all the massive cases we had at the beginning of that pandemic, it's still in there. It's now in the flu shot. So I don't know exactly where vaccination is going with this, but I do really suspect that we are going to start seeing a lot more mRNA vaccinations. They've been working on them for years and years prior to, and this is the first time that there was ever really a mass deployment of them. But I think that that's kind of the way to go, because flu shots are still being made in chicken eggs, and that is a highly inefficient way to still be making vaccinations. And when you're dealing with flus, which often come from birds, you don't want to, if you have an outbreak of a novel flu that starts in chickens, for example, and they're culling millions of chickens, you're going to be losing a lot of eggs. So, there's a lot of reason that we need to keep advancing this technology and not just sticking with something just because it's what we've always done. And a lot of times, vaccinations aren't profitable, and that's why they kind of get not a lot of attention paid to them. So.
Okay, and Carol, do we have any other questions?
No, that's it.
Okay. Julie, I really want to thank you for talking to us. It's so reassuring to have your exact question answered by a real expert. So really appreciate that, and thank you very much.
Hold on. Oh, I'm sorry. Can you guys hear that? That's my little emergency preparedness radio. It's a drill, and it just came on during this. But we'll just ignore that.
Well, we'll let you attend to your emergency.
No, it's just a drill. But anyway, I appreciate talking to this group. I always do, and I like that you guys you always have fabulous questions, and don't hesitate to contact me. If you have, I always remind people, I am not a doctor. I am not a healthcare provider. So always, if you have specific questions that are medical related, just talk to your healthcare provider.
Thank you. Thank you very much.
Thank you. Guys have a great day.
Thank you.
Bye-bye.
Thank you.